Hello and welcome to Community Connections. My name is Addison Davis, Superintendent of Schools. In this episode of Community Connections, we'll talk about one of our social-emotional learning priorities, a sense of wellness. With us to talk about these activities that will take place in the month of October will be the coordinator of mental health. This is Mrs. Heather McDonald. Also school counselor specialist, we have Erika Gilbert, along with Assistant Superintendent of Climate and Culture, Mr. Mike McAuley, known as the Professor. Today, as we talk about activities in October, we really want to focus on creating a healthy lifestyle for our children. So, Ms. McDonald, you put so much effort into creating a healthy environment for our students and also our employees as well. Talk about some of the activities that will take place in October in Clay County District Schools.
Oh my goodness, we have so many things going on. So the very first week in October, we saw the National Walk and Bike to School Month, or Day, sorry. And that really helped us launch into taking care of our bodies. The second week, we looked at National Book Month. We encouraged kids to read a new book. We're really wanting them to stay active in their minds. The third week, we are getting into, which is this week, it's National School Lunch Week. So we want to make sure that they are putting the right things into their bodies. Next week, we have Red Ribbon Week.
Yep.
Red Ribbon Week is loaded with lots of things, focused primarily on drug prevention. Wednesday of next week is Unity Day. Unity Day is the primary day that we look at bully prevention. And then finally we wrap up with some self-care. We want to make sure that students are taking care of themselves emotionally and that we're taking care of our friends emotionally and checking in with one another.
Awesome. So it sounds like an exciting week, a jam-packed month, I would say, within October, but really absolutely needed within our community in this time. You know, Professor, you've done a lot of work around mental health. These activities are truly needed, not only in Clay County, but throughout the state and throughout the nation. Your perspective of how these will truly impact our students in a positive manner?
Yeah. So basically, if we all remember why we are a school system, and that is to teach so kids can learn and become whatever it is that they hope to be after high school, we have to engage kids. We recognize that priorities are things like literacy and numeracy and just understanding who we are as a society. But in order to really capture kids and engage with them, we've got to get that part together. So all of the stuff that Ms. Gilbert and Ms. McDonald and the rest of the teams that lead this work is to connect kids to the adults as part of this process, so that we have that deep engagement, so that real learning can take place.
Absolutely, and I appreciate the work that you've done. You've built a fantastic team. Ms. Gilbert, school counselors, they are truly an important factor within our schools every single day. Not only from looking at academic, historical trends and what the students are doing to make sure they're on their cohort to graduate, but a lot of it from the mental health side. Can you speak to what do school counselors bring to the table so that every one of our viewers can understand how they play an active role and an instrumental role in our schools?
Definitely. So you know that school counselors has grown from being a guidance counselor to now a school counselor, because I think it's all about a well-rounded sense of wellness. And what that means is academic wellness, behavior, and and also in terms of mental wellness. And as you all know, you can't be mentally well or you can't be academically well if you have barriers in the way. So what school counselors do is we work to remove those barriers. So we work with teachers and parents and partners to make sure we remove those barriers. So we have a huge role in that, and we do it every day and working hard. But we definitely like to connect with as many people as we can so that so kids can be successful and well-rounded.
Yeah, well said. And school counselors, we are greatly appreciative for their hard work every single day, and we know their job's not easy, but we thank them. So we launched a really cool initiative last week, and that's our DropIn Clinics, and that's going to be district-wide. We know that that's going to be district-wide in our secondary schools, and we are phasing it in a phased-in process based on availability of clinicians. And so this is an opportunity for our students to drop in to seek assistance, whether it's through therapy or whether it's through mental health. For a little quick drop-in, it could be 10, 20, or 30 minutes. Just allow them to express themselves, allow them to vent. Ms. McDonald, you've been instrumental in setting this up. Can you speak to what these clinics will look like and what the purpose of them are?
Sure. So right now we have drop-in clinics one day a week at most of our secondary schools. Those clinics are staffed by a licensed clinical mental health, a licensed mental health clinician, whether that's a social worker or mental health counselor. And they're primarily meant to be kind of triage. We know lots of our students, it's stressful. It's stressful to be a student. They have so much pressure on them, and often they want to come talk to somebody who doesn't care what their grades are.
Right. Yeah.
Their parents care what their grades are. Their counselors care what their grades are. Their teachers care what
that's
their
right.
grades are. But the counselor, they don't care, and they're able to just listen to them and give them some stress coping skills and prevent them from letting that stress develop into maybe something more significant.
Yeah, it sounds like a great opportunity for our learners. Ms. McAuley, this is, a great vision of you and your teams. And, from your side, I know that you're working hard to make sure that it's exposed to every one of our schools.
Right.
But anything you want to add for the overall impact?
Yeah, I appreciate that. The bottom line is understanding our kids better, who they are. I think the majority of our teachers, hands down, know their kids and appreciate who they are and recognize when there are things that get in the way, as Ms. Gilbert talked about. Using things like the Panorama Student Survey and just better understanding how they perceive themselves inside the classroom, inside the learning environment. Our SEL, our social emotional learning program that we're implementing district-wide, the 7 mindsets, it's really not just for kids, but for the adults in the equation, and just creating a deeper sense of connection between the teacher and the student so that, again, we get better outcomes when it comes to what we want them to learn.
Yeah, it makes a lot of sense, and a lot of services we will provide. We talked about the social-emotional priorities in our school district. One of the things that we truly wanted to do was to create a platform and a consistency throughout every one of our schools where we truly had a fixed social-emotional priorities that we can have an impact on our children's lives every single day. The first one is to make certain that we have a sense of wellness, which we're speaking to today. We have a sense of connectedness and a sense of safety. And these are 3 major aspects that will help us along the way better assist our children. And this is so for anyone, the SEL priorities, what have we seen in schools with the interaction with those?
Well, the 7 mindsets, I think it has been explosive in a great way. I mean, the students are connecting with it, the
teachers are really loving it.
I mean,
I hear that, and all going to classroom excited.
And schools have just dived into it and taken it as part, that they've made it a part of their whole school culture. And I think that truly is going to make a difference in the students and the whole school community.
To the point that's been made earlier, kids are under a great deal of stress today, not just because of academics, but everything outside of academics. And anything that we can do to help bring some sense of wellness there, some relief of that, so that they can be a learner in a way that we all remember being learners. And so the kinds of things that we're bringing to the table, this is just the beginning. We'll learn as we go. We'll adapt. We'll bring new things in. We certainly want to expand our mental health kind of coverage. We want to take better advantage of our community partnership schools that we have at 3 of our schools already. So there's a lot that we can do. And with our partnerships, I think, honestly, the sky's the limit.
I agree, and again, hats off to the 3 of you, what you're doing for Clay County and what you're doing for students and also our employees. We have a lot of kickoff stuff we're doing with SOS initiatives. We have the 30, 60, 90-day initiative where a newcomer comes to our school, and every 30, 60, and 90 days we're checking in on them so they have a sense of connectedness to our schools. We have buddy benches in our elementary schools, and maybe I would sit on those buddy benches more than others, but the good thing is that our students know that if someone's sitting on that bench and they just really need a friend or someone to speak to, and our students are gravitating and using it every single day. So, thank you for what y'all do every single day for Clay County. Our job is to make certain that it's just not, mental health is just not a topic, but a systemic approach and a framework that really helps our students and helps our employees. And what we want to do is create the safest space possible to remove any barriers for our learners so they can be successful within Clay County. So, again, thank you again. We really appreciate it. For those of y'all who are watching, we really want to make sure that we focus on the emotional, social, wellness of every one of our learners and every one of our employees. And, we're in a beautiful spot today on a field because wellness isn't just mental wellness, it's physical wellness as well. And, we got these young students that are running, getting out of it, taking advantage of their opportunity and their time to care about themselves. And we hope you'll join along the way in this great month. So thank you for everything you do. Thanks for trusting us with your children every single day. And I look forward to seeing you in our next episode of Community Connections.